Hello friends, welcome to my YouTube channel. Today we are going to see the osteology of skull. You know, the skull is the skeleton of head. It forms the cranial most end of the axial skeleton. There are 29 bones in the skull. Some are paired and some are unpaired. Let us see the bones of skull. So here we have the frontal bone, these two parietal bones. Posteriorly we have occipital bone. So here is the temporal bone. This is the zygomatic bone. Here we have the maxilla. These are two nasal bones. See here we can see the greater wing of sphenoid. Today we are going to learn the Norma verticalis. You know, the Norma verticalis is the vertical aspect of the skull. First, let us see what are the bones seen on the Norma verticalis. So first here we have the frontal bone. You can see two parietal bones, and posteriorly we can see the occipital bone. And you know, there are some sutures visible on the Norma verticalis. The first one is present between the frontal bone and two parietal bone, and this suture is known as the coronal suture. Here, you know, two parietal bones are connected by means of a suture which is known as a sagittal suture, and posteriorly we have the parietal bones and the occipital bone are connected by means of a suture. This suture is known as lambdoid suture. And you know, the point at which the sagittal suture meets the coronal suture, this particular point is known as brecma. And this brecma is a membranous gap in the fetal skull which is known as anterior fontanelle, which closes by 18th month. The same way, the sagittal suture meets the lambdoid suture, and that particular point is known as lambda, and it is a membranous gap in the fetal skull which closes by 2 to 3 months. Then, what do you mean by vertex? You know, vertex is the highest point of the sagittal suture. So here we have the sagittal suture. That highest point of the sagittal suture is known as vertex. And this arched part of the skull, which is known as the vault of skull, cranial vault. You know, here we have two parietal bones, and maximum convexity of the parietal bone are known as the parietal eminence. You can see the parietal eminence here. So these are the parietal eminence. If we examine this sagittal suture, almost 3.5 centimeter in front of lambda, on either side of the sagittal suture, you can see two foramina. These foramina are known as the parietal foramina. Parietal emissary vein is passing through this parietal foramina. And part of the sagittal suture in between these two parietal foramina, this point is known as obelion. That is the obelion. This point is known as obelion.